Thank you for tuning into Docs and Boxed. Make sure you guys like this video and subscribe to our channel so that more people can get the content that you love. Enjoy! Welcome to the fifth episode of the Docs and Boxed podcast. I'm joined with Dr. Hinshaw today. I'm very excited for this episode because neuroscience is something that I love, but before I say too much, I'll let you introduce yourself with your name, job, education, just the basics.
So I'm Steve Hinshaw, Distinguished Professor of Psychology at UC Berkeley and Professor of Psychiatry and Behavioral Sciences at University of California, San Francisco. And I do work on developmental psychopathology, the development of typical and atypical kids, what are the precursors to mental and neurodevelopmental disorders. I do treatment studies. I'm very interested in families and peer groups and neuropsychological processes. And I'm also quite interested in the stigma that still clings to people with mental and neurodevelopmental disorders and how we can get rid of that stigma.
All right, cool. So just to get started, I wanted to talk to you about just disorders, but mainly ADHD in general, because I think that's something that's really misunderstood, like still today. Because on one hand, you'll have people that overgeneralize it. Like you see anybody struggling to pay attention in class, and then somebody will be like, "Oh, they got ADHD." But then on the other hand, you also have like a lot of people that they kind of dismiss ADHD as like an excuse for not being able to perform or something. They'll be like, "Oh, it's not a real disorder." So what can you sort of clarify about what ADHD actually is and how it impacts the brain if it does?
So ADHD is a neurodevelopmental condition, or as some would call it, disorder. It's not truly a disorder because it's not one thing. There's, as with depression or bipolar disorder, et cetera, many pathways can lead to somebody having a pretty serious ADHD.
Mhm.
It's a condition that's in some ways misnamed. It's not an attention deficit disorder.
Mhm.
Many people with ADHD exhibit what we call hyperfocus. If they're really into a project, really committed to it, really motivated intrinsically by it, they can't do anything else but that project. Forget to eat lunch or dinner and forget everything else in their lives. And so when we think of ADHD, it's not just about attention. It's a condition in which it's hard to regulate your attention and your working memory and your ability to inhibit impulses. It's a regulatory disorder that makes it harder for you than neurotypical people without ADHD, to do that regulation. So you may find yourself with tasks that are difficult or very rote, really impossible to stay focused on it. But again, you may hyper focus for something that is really up your alley.
Mhm.
ADHD is based in the genes a person is born with, much more that it's based in parenting or culture, etc. There are some people who are more prone to develop this consistent inconsistency known as ADHD. But if you have that genotype, and again, there may be multiple genes that lead to these symptoms, how you're parented, how you accept yourself, whether the school makes the right accommodations to help you learn in the right ways, has everything to do with your outcome. So if we say that ADHD, which is accurate, 80% of the risk for it is composed of the genes you're born with, that doesn't mean you're doomed to genetic destiny. As you learn to self-regulate and organize and find ways to motivate yourself, both intrinsically, internally, and externally, you can cope with ADHD, and many people with ADHD can be quite successful.
All right. So what I'm hearing is like it's mostly genetic, but like sort of how you're brought up can impact like the presentation of the condition, right?
That's right.
Mhm.
It's how a family and a school may adapt and set up clear structures as well to bolster the out of the box thinking and the quick style and maybe the tendency not to sit down all day at school. If you can modify that environment and allow for those neurodiverse differences, with the right materials and the right motivational structures, people with ADHD can and do thrive.
Yeah. So leaving the second part of that for later in the episode, I kind of want to talk about you mentioned that it's 80% genetic around. So how do those like genetic differences, like how do they present in like the functioning of the brain? Like what sort of like different neural processes or like brain chemistry do ADHD patients have compared to neurotypical?
So this is the big question for the last several decades once neuroimaging really came into being.
Mhm.
First, on the genetics, the heritability of ADHD is around 80%. That doesn't mean that if you have ADHD, 80% of it's caused by genes. It means that the reason some people have ADHD and most people are more regulated in their attention is 80% the influence of different genes rather than different environments. So genes are responsible for those individual differences. But it's not one gene, it's not two, it's not 5 or 10. It's scores of genes, maybe hundreds of genes inherited together in complex ways. So we used to think we were going to find the gene for ADHD, the gene for bipolar disorder, the gene for schizophrenia. In the last 15, 20 years, we realize throughout many physical illnesses and certainly mental disorders, they're polygenic. There's multiple genes that sum together to create the liability. And those combinations of genes for people with ADHD make it more difficult for such people to develop intrinsic motivation for tasks or school assignments that aren't right up their alley, right? So it's going to take some external rewards and maybe in moderate to severe cases, medications that help regulate dopamine, the neurotransmitter that helps one focus attention in the right circumstances, helps intrinsic motivation. So the brain, there's not a one brain region that contains ADHD. Certainly right behind the forehead here, the frontal lobes and the cortex, the thin bark, cortex in Greek is bark, the outside of the tree where the gray matter is, the cell bodies are. In kids with ADHD, that frontal cortex is slower to develop by several years than in neurotypical kids. And those brain developmental differences persist into adolescence and adulthood. But there's other parts of the brain that contain dopamine pathways that go from the cortex down into the midbrain regions, down into some of the motivational regions that with practice and rehearsal and extrinsic reward and ADHD medications, if they're really prescribed well and monitored well, can really make a difference in a person's motivation and focus.
Mhm. So I'm hearing a lot about dopamine, and that's
Right.
interesting because I don't know, I feel like a lot of people usually associate dopamine with motivation, right? So
Right.
how do you think that connects to like some of the attention regulation problems that we see?
So in a very famous study done now 15 years ago by Nora Volkow,
Mhm.
the director of the National Institute on Drug Abuse, NIDA, and she's an expert at looking at the brain mechanisms underlying addictive behavior, ADHD behavior. She got a sample, this took a long time to gather, of
Mhm.
about 70 adults with very clear ADHD and no other co-occurring disorders. And these adults also had never had any ADHD medications, which might influence levels of neurotransmitters or receptors. And she got a control group of about 50 or 60 matched adults who didn't have ADHD. In key brain pathways that subserve intrinsic motivation and subserve response inhibition, the ability to say, no, I shouldn't do this now, I should wait till the right time.
Mhm.
The adults with ADHD had 40% fewer receptors for the neurotransmitter dopamine.
Mhm.
So, in at least some cases, and these are adults who'd persisted with ADHD since childhood, it may be that there's an inborn deficit in dopamine functioning underlying many people with ADHD, which is why, even though such people can be quite creative and quite good in the right settings and the right jobs, in order to succeed in school and succeed in relationships in vocational settings, may need that extra dose, if you will, not just of medication, but of the right kind of structure and organizational skills and time management to make it through a day well. And it may be that the main medications for ADHD, the stimulant medications, which are selective dopamine reuptake inhibitors, they keep dopamine in the synapse a little bit longer than it would be otherwise, that improvement of the flow of dopamine in the brain can also help with intrinsic motivation and focus and kind of getting it together in the right circumstances for people with ADHD.
Mhm. So talking about treatments for ADHD, are like the medications that are prescribed, are they like, is there anything outside of dopamine that clinicians like you try to target with medication or not?
Well, most of the stimulant medications that, again, target dopamine also target norepinephrine.
Mhm.
And there's another class of medications called kind of the non-stimulant alternatives for treatment of ADHD are selective norepinephrine reuptake inhibitors. So they keep norepinephrine in the synapse in the different brain pathways that norepinephrine subserves as a neurotransmitter. And that can help with motivation and self-regulation as well.
Mhm.
There's other norepinephrine medications, noradrenergic medications that are sometimes used for hypertension that also help regulate norepinephrine's flow in the brain, and they can be helpful for people with ADHD as well.
Mhm. Real quick for the listeners that aren't sure what norepinephrine is, because it's not as like famous as dopamine is, I guess. Could you sort of go into what like we know about the function of norepinephrine in the brain?
Well, norepinephrine is just one chemical step away from dopamine. They convert into one another.
Oh, okay. That's
And
it.
norepinephrine has pathways that are intermingled with the main dopamine pathways. There's a dopamine pathway way down toward the brainstem that helps you regulate voluntary motor movement. Other dopamine pathways go from these midbrain regions up to the frontal circuitry, help with motivation and executive functions and planning. Norepinephrine traverses somewhat different but overlapping pathways, and norepinephrine is a really good regulator. Norepinephrine subserves memory, and it also subserves regulation of body and brain and behavior in ways that are more subtle than the dopamine medications, but over a period of a long trial, people with ADHD may respond to those medications as well.
Mhm. All right. Moving on to another treatment. I thought this was really interesting and I wanted to discuss it with you. So I'm not sure if you're aware of it, but there's actually like an FDA approved video game treatment for ADHD. It was developed by Acolyte Interactive. It's called Endeavor.
Yeah.
But basically what it is, it's a game where the players they like I think you're in control of a spaceship, if I remember correctly from the video, and you like move it through an obstacle course, collect coins or like whatever other rewards. So what do you know? Like, do you know much about how that works and like how
So
that is?
it's a virtual environment playing a video game, but not just a fun video game. It's one where you have to overcome challenges and delay your response sometimes in order to get to that reward
Mhm.
and remember where things are located. So it's trying to teach and train the brain to have a better working memory and better response inhibition. In the trial, the big study that was done that got the FDA approval for this game, um, the main measure that it worked on was a computerized test of
Mhm.
how well you pay attention. But that's sort of what the game is too. It's a fancier computer test with a lot of flashing lights and really cool stimuli. On the other measures of parents and teachers report of attention in school, doing homework, things like that, there were not nearly the effects that you get with medication or with behavioral reward-based treatment. So Endeavor um, may be a good supplement to help people focus and sustain their attention better, but it is certainly not a replacement for the evidence-based treatments of behavioral and cognitive behavioral reward-based programs and the medications known to help people with ADHD.
So like basically what I'm hearing is like with Endeavor, it's just like you're just sort of like kind of trying to train like their attention and stuff, but like that
That's
can't
right.
yeah, by itself though, it can't like replace any.
So as far as we know now, with the evidence out on it, it may help with those focused efforts, if you will, playing something similar to Endeavor, but it doesn't generalize into the real world the way that we would like it to. And maybe further adaptations or combining games like Endeavor with medications and reward programs. What we know for sure is that for the majority of people with ADHD, kids, teens, or adults, combining the best of medications with the best of reward-based treatments and organizational skills, et cetera, usually lead to the best and biggest results.
Mhm. Sort of similar to Endeavor. There was another game. This was the details are a little fuzzy on this because I think I read about it like a year ago. But there was another game that was tested. It didn't go all the way to the FDA. It was just a small study with a game called I think Emotional Faces Memory Training. I don't know if you've heard of it, but I
I
think
know of the principle behind it. Yeah,
yeah, yeah. So I think the main thing was like functional connectivity in the
right,
brain.
right.
You train different regions of the brain at the same time. And then the study said that it did improve the symptoms of patients with ADHD. But like you said before, obviously like ADHD, it isn't contained in any specific brain region or like
That's right.
so like what are your thoughts on like sort of like the validity of that? Or do you think in the future that could sort of progress to like a more valid treatment?
A lot of people are developing apps, games to help improve the motivation, attentional focus, inhibitory powers of people with ADHD. I say more power to the developers if they put them to rigorous tests and if we don't overpromise that they're going to be the cure for ADHD. As with depression, as with PTSD, bipolar disorder, schizophrenia, everyone would like the magic bullet, but these are complex conditions that are going to require psychological, behavioral medications when indicated, and maybe tech-based interventions.
Mhm. So you also spoke about sort of like having integrating different treatments to help patients with ADHD. And I saw on your page that you have a project called the multimodal treatment study of ADHD children. So can you like explain? I don't know if you can, but if you can you go into more depth about that study, sort of what you found about it and what's interesting?
So this was 25 years ago, a big study done at 6 centers in the United States and one in Canada.
Mhm.
At the time, it was state of the art. In many ways, it is, where about 600 children between 7 and 9 years of age were carefully diagnosed with ADHD, 80% boys, 20% girls, and then assigned randomly, regardless of what their test scores and behavioral ratings were. It was a total random assignment to get really well delivered ADHD medications for about 1.25 years. Number two, to get parent management training so that parents are setting more consistent and clear rewards, consulting with teachers and having an aide in the classroom for a period of time to help the teacher set more consistent expectations and deliver better rewards, and an intensive 8-week summer camp in between the 2 years of the study for kids to really learn academic skills and get a lot of behavior modification for social skills, etc. So medication only, behavioral treatment only. A third condition was you got both together, the best of the medication and the best of the behavioral treatment. And the fourth group, 25%, we didn't say don't help your kids for the next 14, 15 months, but we said whatever treatment you can get in the community, do it. So a lot of those kids got medication as well, but it wasn't monitored every month the way the MTA, multimodal treatment study of ADHD, did. And the behavioral treatments weren't nearly as intensive.
Mhm.
What we found was that if your goal is to improve ADHD symptoms, parent ratings, teacher ratings, medication usually works pretty quickly within a few weeks and has a pretty big effect on average, not for everybody. And adding all the behavioral treatments doesn't really improve that symptom-based improvement very much. But if your goal is to improve the kids' academic skills in reading and math and social skills at school, and to improve parenting so that it's a more firm discipline, but also with a lot of warmth, and also to help improve the kids' kind of acting out aggressive behavior and the kids' anxious and depressed behavior. It really took that treatment number three, the combination, the combined medication and intensive behavior therapy to really yield the effects beyond the ADHD symptoms. So multimodal treatment on average is going to be better than any single modality is the main message we learned from the MTA. If your goal is to do more than just improve the symptoms.
So, just for curiosity, like with the group of just patients who received like the intensive behavioral therapy, what sort of like what did you observe from that group?
So parents became more authoritative, as we call it, less yelling and screaming and cajoling, more reward based, more positive in their approach.
Mm.
Kids learned math and reading skills better than people without the intervention. But if they got the right dose and style of medication at the time they got that behavioral treatment, the big improvements in social skills and academic skills and parenting were really pronounced.
Okay. So another project that I saw, again, I don't know like how much you can say about it, but with the Child Life and Attention Skills Program, could you sort of go into detail about that, like what you found?
This is a program developed by my close colleague, Dr. Linda Pfeifner, PFIFFNER at UC San Francisco. And she's been an expert for a long time in particularly kids with what we call the inattentive form or type or variety of ADHD. Not impulsive, not overly active and fidgeting, but may appear spacey. Don't do well in school because they don't remember the 2 and 3 part commands that the teacher and directions are giving. They're not as in your face. They're not disrupting the classroom the way that kids with a lot of hyperactive impulsive symptoms, the kids with a combined form of ADHD, the combination of inattention and hyperactivity and impulsivity. But they have a lot of problems later on without treatment. So the CLAS, CLAS, the Child Life and Attention Skills Program, is part parent management and part group treatment for these kids to learn better social skills, to learn better attention skills, and to help. And this is a treatment, we did not include medication in this treatment study. And a few kids got medication on the side anyway, but most didn't. And we found that the combined class treatment, child life skills through parents and through their group participation, was superior to parent management work only in terms of improving behavior at home and at school. So it's again, combining interventions, teaching multiple skills and rewarding kids in multiple aspects of their lives seems to be the best bet.
So when you talk about group therapy, we've talked about obviously like parent management before, but what does group therapy entail? Like,
So this is not sitting around and sharing feelings, although sometimes that can happen. You learn to identify various emotions, etc. But it is a structured reward-based program where a couple of adult leaders and a group of 6 or 7 kids are learning how to introduce themselves to one another and learning how to follow the rules in a game. Then they practice the game. They're learning cooperation rather than grabbing things or saying mine or withdrawn. And so this very structured behavioral approach can help these kids develop and learn, and it reinforces their developing social skills that goes along with the parent management training.
Mhm. So in the future, like going forward, do you think the best bet is to just stick with the combined multimodal treatment, like with medication, or do you think medication and obviously like the behavioral therapy, or do you think like there could be more advancements in the future that could reveal something else, like maybe like a cure or a better sort of treatment?
Yeah, well, as kids get older, they get to be teens and adults rather than just behavior therapy, cognitive behavior therapy, CBT, teaching yourself to self-reward, learning better organizational skills, anger management skills in an individual or group format, where you're helping the person develop the right kind of self-talk, right self-instructions to go along with the rewards. Those are very promising for adults. There may be neuromodulation, certain brain stimulation strategies that we have yet to put to the real empirical test yet that may help. Again, I don't think they're going to be standalone treatments, but they may supplement the behavioral and medication treatments. And there's a lot of interest in mindfulness and meditation treatments, which again may be quite promising, but the big name of the game in ADHD treatment is what works in the office has to generalize to the classroom or your vocational workplace as an adult or in your relationships or how you deal with friends. So I think it's a mistake to think that any office-based treatment is going to generalize automatically unless there's a lot of time put in and skill building.
Mhm. Makes sense. I saw just one last thing with the treatment. I saw like another study. This was with some sort of genomic therapy for ADHD because in the last few years, there's been like a lot of advancements in like genomic engineering and stuff with systems like CRISPR-Cas9. But obviously you mentioned that there's gene like ADHD is not just like there's one gene or like two genes,
Right.
there's a lot. So do you think we could ever see something like that working, or is that sort of like a moot point?
It's hard to say. There may be certain genes, some genes are master genes, they control the function of other genes, that with some modification, it might help some people with certain forms of or certain patterns of inheritance of ADHD. But it's not going to be like Duchenne muscular dystrophy, where there's a single gene and we might be able to modify that uh, DNA and RNA pattern, et cetera. I think it's going to be a tougher game for those kinds of therapies for ADHD. But the more we learn about genomics and the more we learn about brain pathways and the more we learn about combined treatments, I wouldn't bet against it in the future as a supplementary treatment.
Mhm. Yeah, speaking of like a quick tangent, speaking of the Duchenne muscular dystrophy treatment, I saw that like a few weeks ago with the expanded FDA approval. I thought it was very interesting. Like, do you know anything more about that that you can share?
It's out of my expertise.
Mhm. All right. Well, moving on. Like one of the things that I found most interesting about you specifically was that not only do you do research with the sort of like biological aspect of ADHD, you also do a lot of work with the stigma, which I think is equally as important, if not more important. So, sort of like what inspired you to study like that stigma? Because I don't see a lot of people doing it, and how do you like approach it?
So my interest in stigma is part of my upbringing, my family life. Had a great upbringing in many ways back in Columbus, Ohio, but my dad would disappear for weeks or months or at one point a year at a time without explanation. We didn't know where he was. My sister and I, we didn't know whether he was alive or dead. He had very severe bipolar disorder. It was misdiagnosed as schizophrenia for most of his life until I really helped get the right diagnosis when I was in college for him. And he was away at some of the nation's really horrible snake pit like mental hospitals, where he didn't he barely survived some of those hospitalizations. And I didn't know, my sister didn't know, because the lead doctor in Columbus told him that your children can never learn of your serious mental illness or your hospitalizations. It will permanently destroy them. So you and your wife, our mom, are never allowed to use the term mental illness. So that was the doctor's orders.
Mhm.
So what would we say today to the oncologist who says, boy, that cancer you have, mom or dad, is so potent and toxic that you can't mention the word cancer, it will destroy your children. Well, we'd sue the doctor for malpractice because families need to support the battle against cancer.
Exactly.
Mental illness is kind of where cancer was 75 years ago. Back in the mid to even late 20th century, you'd never put cancer in the obituary of your relative who died from it
Mhm.
because we sort of knew that it was a disease you brought on yourself because you'd lost the will to live. Cancer was highly stigmatized,
Mhm.
kind of a forbidden topic. And cancer's now, because of the great public interest and because of support groups and advocacy groups, everybody's in the war against cancer, right?
Mhm.
But mental illness is still thought to be, in some parts of the world, caused by evil spirits. In many parts of the world, you're a weak character, you're morally flawed, you don't live your life right, or it's all bad parenting rather than genetic influences. So as I got interested in kids and treatments and ADHD and other conditions and depression and bipolar disorder, along the way, I picked up my game and really got interested in writing books on and doing studies of how can we reduce stigma in the general population.
Mhm. That's a really sweet story. So talking about like the books that you've written, like what are some of the what are some of your like I guess favorite ones? Like what do you think are the most important points to get out of those books?
So if something's going wrong in a family, parents are separating, there's violence in the home, there's drinking or drug use, there's serious mental illness, for example, but nobody talks about it, leaves kids baffled. So a kid in that situation might think or come to believe the world's kind of a random, cruel place. Not a very healthy way to think about the world.
Mm,
Or the kid may think, as I certainly did when I was young, it must be my fault. Maybe I'm not a good enough son. Maybe I shouldn't ask so many questions about where dad was because it was very clear that I wasn't allowed to. So, what do we call that? That's a process of internalization. I took on responsibility, even though I wasn't at all responsible for dad's bipolar illness, the responsibility that maybe I'd helped cause or perpetuate it. But internalization means you blame yourself. Internalization, interestingly, anxiety and depression and being very withdrawn, we call those internalizing forms of psychopathology. And it's sort of almost a play on words. If you start to blame yourself unnecessarily, it may preserve the thought that you have some control over events, but it comes at a cost of lowered self-esteem and the feeling that you're hyper responsible for everybody all the time and you're not very good at self-care. So I think that's a big lesson. What do we do with cancer? We talk about it and we help the family get involved to support the treatment. I'm not saying that for very young preschool age children, they learn the facts about schizophrenia or bipolar disorder or major depression. But the family has to talk about why dad or mom is absent, why the police came to home that time, or why mom and dad are arguing the way they are, et cetera, et cetera. And there's good forms of family therapy now that really help parents talk with kids about what everybody knows at some level, but no one is admitting because of the shame and fear and stigma. And those kinds of family, it's called family talk, those kinds of therapies prevent internalization and help kids from becoming depressed themselves as they grow up.
mhm. I think like in addition to that, like some there like the value in talking about mental illness and stuff is also because it kind of prevents like the cycle of oh people believing that oh like it's caused by I don't know like a weak character or some of the other
Right. That's right.
so
Yeah.
like,
That kind of horrible self blame that only makes things worse.
yeah.
Yeah.
With your work in Stigma, I also saw your Let's Bring Change to Mind project. So
Right.
can you elaborate more on that?
So about 14, 15 years ago, got in touch with some people in Southern California, and we started a program called Let's Erase the Stigma, which is groups in high schools, clubs, not therapy groups, but like a chess club or a Latin club or a rugby club. There'd be the Let's Club, where kids get together and talk about their own mental issues or their families or their friends, and how do we stop this dissing, this disrespecting and stigma. And we designed elements of a curriculum. We don't tell, it's not like lesson 1 and 2. Every week the club meets, it decides on activities from a kind of a menu of evidence-based uh, talks from people with lived experience, meditation apps, et cetera, et cetera, et cetera. And over the years, this program got taken over by an organization called Bring Change to Mind, founded by the actress Glenn Close in 2010 because of the very severe mental illness in her family that was never talked about when she was growing up.
Mhm.
And so now we're in this fall, close to 600 high schools around the country sponsoring these anti-stigma clubs with the support of staff at Bring Change to Mind and hoping to get dialogues in schools, in families, in communities, opening up. Let's start a conversation about depression. Let's start a conversation about trauma. Let's start a conversation about anxiety or bipolar disorder, so that it's not the subject of shame. It's not kept under wraps or under covers.
Mhm. Like in addition to clubs like that, which I think is a really cool initiative, what are some other like realistic, tangible steps that you think we can take like as a society to sort of work towards like destigmatizing mental illnesses the way that we've destigmatized cancer and stuff in the past?
So it's a super important question, and I'll give the example, which I sometimes do, of climate change.
Mhm.
One of the biggest issues of our species right now. How are we going to stop this insidious climate change? How are we going to get our planet healthier? We can't do just one thing.
Mhm.
We probably need carbon taxes. We need policies, right? National, international levels. We need individuals to take recycling seriously. We need to have conversations about the effects of heat and pollution on kids' development and on people's moods and aggressive behavior. Similarly, for mental illness and the stigma that surrounds it, at the top-down level, we need to enforce the Americans with Disabilities Act, which makes it illegal to discriminate against people with mental or physical disabilities in the workplace or in public. We need to enforce parity, Parity, the same insurance coverage for a mental disorder or a neurodevelopmental disorder as you get for your heart problems or your lung problems or your bone break problems. It's on the books, but it isn't enforced well enough. Another level is media. Even in video games, very popular among certain generations and especially males, but also females, um, video games are some of the most stigmatizing of any form of media about how awful mental illness is. Violence and incompetence are the main themes. And this goes for newspaper headlines. It goes for websites. It goes for social media. Now, the good side of some social media is that it's all about authenticity and being different, and that's okay. But it can also get sensationalized. Uh, the TikTok phenomenon of a couple of years ago, where women, girls and women who do get ADHD, the stereotype it's a boys only condition, TikTok really helped to promote lived experience and sharing, but it also, in some forms, would be just do this quick 3-item checklist online. And now we know you have ADHD, and you can even get medications mail ordered to you, which is, because stimulant medications can be addictive if in the wrong hands, is a dangerous practice. And the ultimate goal, I think, to reduce stigma is humanizing. You're not a devil. You're not the product of an evil or animal spirit. You're not a weak person. It's a sign of strength to reach out for help, not a sign of weakness. And by cautioning people against making ridiculous, horrendous jokes about mental illness, which is, happens all the time. It's in our very language. And by promoting the idea, the way cancer survivor groups did, that this is something with the right treatment that we can really affect a lot of lives and families. One of the best anti-stigma measures is getting really effective treatment out to the community. We know a lot of treatments work for ADHD and depression and bipolar disorder around universities or in affluent populations, but we need to disseminate those treatments to the people who need them most.
Yeah.
So it's
Um,
going to take a multiple levels approach.
yeah. I think that's wonderful. We've actually finished like right on time because the meeting's about to end. So, thank you so much for your time. And
Great.
yeah,
Thanks for your good questions. And did we miss anything?
no, I think we're good.
Okay, great.
You had like a really great message with like how to approach it. So I was
Thanks
happy.
so much. And keep up this great work with your podcast.
Thank you. Have a good
Take
day.
care.